The Association of Medical Laboratory Scientists of Nigeria is the body which brings together all medical laboratory scientists in the nation. The association takes care of the welfare of its members, promotes the profession, and shares current medical information amongst its members. The chairman of the Oyo State branch of the association, Mr. Akimbola Idowu, speaks about the activities of the association and the dreadful coronavirus pandemic.
The Association of Medical Laboratory Scientists of Nigeria is the association that brings together all the medical laboratory scientists that we have in the state. Of course, we have three levels of the association. We have the national, we have the state, and of course, we have the chapter. And when you talk about the National Association, that is the main body that brings everybody together, irrespective of where you are practicing within the country. And of course, at the state level, the different states of the federation, we have the association too, to allow for effective coordination of the members, at different states. And that is where I am a chairman here in Oyo State. And of course, we also have chapters. Chapters is when we have, people that are working in a particular organization coming together to say, oh, let's form our own association. And of course, all those chapters, they are under the association, the states. So the chapters make up the branch, the branches make up the national. Since the advent of this particular outbreak, the association has played so much role to ensure that we curb the spread. Number one, we are one of the major frontline healthcare workers. And how are we the first contact? When somebody is suspected to be having this particular infection, we are the first set of people that are contacted to collect samples from them. And so our members are involved in the collection of the sample all over the state. After that, we also ensure that we did hand sanitizer. We produce it. We are medical laboratory scientists. We are professionals. We work with chemicals. Number three thing that we have also done in the course of this COVID-19 is to educate masses. We have educated a lot of people, most especially on basic hand wash. Another thing we did was to also, produce what we call VTM, viral transport medium. And we produced about 200, bottles and gave to Oyo State government. Medical laboratory science profession, we play very critical role in the health industry, most especially in effective diagnosis, in the treatment of patients, and of course in the effective management of patients. We also play a very critical role in prevention of infection, which is one of the major roles we are also playing at such a time, critical time like this. Well, let me say that everybody have a role to play in preventing and curbing the spread of this particular virus. We all pray that it doesn't get to us. But you see, there are some basic rules that we must observe to ensure that this particular virus does not get to us. Some of the things that we are expected to do is, number one, let me talk about the issue of hand wash. Hand wash is so important. And I believe that is one of the lessons that this particular pandemic is going to live with us. We have to be hygienic in what we do. Number two, let us also ensure that we avoid touching, our face without washing it.
The medical laboratory scientists are one of the most important units of the health industry. They help to provide clarity to all health-related issues. They also help to provide timely and accurate medical care to patients. And as far as the current coronavirus pandemic is concerned, they have been at the forefront of it.